Hi, Dr. Semenoff. This is Brittany Troxel.
I'm Elizabeth Bristow.
I'm Jade Aranthia.
And I'm Lupe Barron.
And here's our CLC presentation for the body assessment.
All right, so to start off with the individual background history, our client's name is Jennifer. Her age is 20 years old, and her current occupation is she's a student, a sophomore in college, and she is a telemarketer for her job. And her recreational sport history is she played volleyball and she swam for all 4 years of high school. Her current activity is she tries to walk to classes and walks her dog at night for 15 minutes. And she does not go to the gym, but she does swim for fun at moderate intensity for about 20 minutes each Sunday. She lays on her bed to relax and tries to avoid sitting on the couch because she already sits all day at school and her job. So as you can see, the client's medical history is not very bad. They currently have high cholesterol, but that is the only medical condition they report for themselves. The client is at risk for more chronic diseases like cardiovascular disease since they are sitting so often. Sitting in constant stress of the job and school and lack of regular physical activity can easily cause one to be at higher risk for chronic disease. So even though they do not have an extravagant cast of medical issues, that does not mean that their current lifestyle couldn't lead to chronic diseases. And now we're going to move on to static posture analysis.
Yes, so in the static posture, you are just standing still and you're in the anatomical position, so you're not taking any movements. And to start off, the kinetic chain is used for seeing the malalignments in a static posture, and it's defined as the mechanical linkages between the body segments that allows for sequential forces and motions. And so the checkpoints for the kinetic chain that we see here is the foot and ankle, and then the knee, and then up to the lumbopelvic hip complex, which is the LPHC. And then we're also looking at the head and cervical spine or the upper body. And then in the images that we see here for the static posture, in the anterior view, we can see that the knees are not in line with the toes. The right hip is elevated, the left shoulder is elevated, and the head is tilted to the right. And then in the lateral view that we see that the head is in excessive extension. And then also in the posterior view, similar to the anterior view, we see that the right hip is elevated, the left shoulder is elevated, and the head is tilted to the right. And then moving on to the transitional movement assessment, we had two transitional movements that we are going to be looking at, which is the overhead squat and the single leg squat. There are a few different checkpoints for each of these. Starting with the overhead squat, the checkpoints for the anterior view include the feet and the knees. For the lateral view, we have the LPHC and the shoulder complex to look at. And then for the posterior view, we have the feet in the LPHC. And in the images that we see here for the overhead squat, for the anterior view, the feet turn out, and this can be caused by an overactive soleus muscle to cause the feet to turn out. And then in the lateral view, we see that the tibia does not stay in line with the torso, as well as in the posterior view, we see that the feet flatten, and this can be caused by an overactive lateral gastrocnemius and a TFL. And then the checkpoints for the single leg squat for the anterior is the knees, the LPHC, and the upper body. And in the anterior view, we can see that the hip hikes, and this can be caused by an overactive TFL or gluteus minimus.
Okay, we are now moving to the dynamic posture assessment, and we decided to go for the gait analysis observation. So the purpose of this test is to essentially determine if there's a correct posture during ambulation, which technically is walking. For us, we are looking for, during the anterior view, we're looking for the feet and knees. The lateral view, we're observing the lower back, shoulders, and head. And for the posterior view, we're looking at the feet and the LPHC. And we're just determining if there's any observation, any abnormalities. And based on our client, her feet are turned out, which this could essentially mean with the muscles overactive. Could be the soleus, the lateral gastrocnemius, bicep femoris, or the TFL. As for underactive, they could be the medial gastroc, the medial hamstring, gluteus, and the maximus. And based on her background, we notice that it could be the reason why her feet are going out due to sitting so much. When one is sitting too much, is because her hips are lengthened, and due to this, it could lead to a weakness. As for the hip hikes, as talked by the previous slide. It could be an overactive TFL and underactive gluteus minimus. The reason why is because if we look at the origin insertions of these muscles, it's about the ilium, and obviously when one's sitting down, it's being not worked. And sitting in the same position after a long period of time could be the reason for her lateral pelvic tilt. A research study by Lee in 2018 focused on 30 students, and they pretty much did observe their position, determining what can be affected if they are sitting for too long. And results showed that there was a right sitting pressure higher than the other side. So this just proves that one side can be weakened and the other side would compensate for the lack on the other side.
And then for our second assessment, we went ahead and did the standing overhead dumbbell press test. So first we want to talk about how research suggests that completing overhead dumbbell presses are safe to complete in order to optimize range of motion. So we went ahead and did this test. There are 3 checkpoints, which are the lumbopelvic hip complex, the shoulders, and the head. So for the first checkpoint, in both the posterior and lateral analysis, there was normal findings of overall. So there was no compensation, and this means that there was no low back arching. So then for our next checkpoint, we have the shoulders. In both the lateral and posterior analysis, there was compensation in the shoulders. Things that occurred was the arms migrating forward as well as the shoulders elevating. A potential reason as to why the arms might be migrating forward can be due to overactive muscles such as the latissimus dorsi or the pectoralis muscles such as the pectoralis major. And some underactive muscles can be the rotator cuff muscles or the mid and lower trapezius muscles. Another reason as to why compensation could occur, such as the shoulders elevating, can be due to overactive trapezius muscle, and specifically the upper trapezius, as well as underactive muscles such as the mid and lower trapezius. In the third checkpoint of the head, there was compensation in the lateral analysis. The head did migrate forward, and this can be due to an overactive upper trapezius as well as an underactive deep cervical flexors. This can all be contributed to her job since she sits at a desk all day, and this can lead to overactive or underactive muscles in her body. And then next we have our reference slide.
Thank you.
Thank you.
Thank you.